And we will begin the COVID public briefing. My name is Brian Beam, Calcasieu Parish Administrator. We are having a briefing today, of course, to give an update on the COVID-19 status in Calcasieu Parish. I think we are all aware now that it has actually gotten a lot worse since we last had a briefing. And we've got some folks here today to talk more about specifics and make recommendations on things that they believe we need to be doing a better job at. So we'll get right to it. We actually have a lot of folks here in person today, as opposed to remotely. And we've got some special guests, but I'm going to start off by having Dr. Lacey Cavanaugh, Region 5 Office of Public Health Director, come up, make some comments, and then she will introduce the other folks to give a little bit more of a perspective from the medical folks in the middle of all this and what they're dealing with. So with that, Dr. Lacey Cavanaugh.
Hi, good afternoon, everyone. I'd like to start by saying that the situation that we have here in Southwest Louisiana in regards to COVID has continued to become more serious over the recent weeks. We have seen substantial growth in our number of cases, as well as our hospitalizations. In comparison to our previous peak, we have twice as many hospitalizations across this region as we had at the peak that we had in April and early April. Our deaths are starting to increase as well, and these are not just older folks who have tons of comorbidities. It can happen to young people as well. I'd like to reiterate, as we've talked about before, this disease is not just the flu. It seems to spread much more rapidly, and it can be more deadly. So today, instead of talking just about those rising case numbers, I really want to make this also about stories. I want you to hear from some of the folks who are fighting COVID in our hospitals across this region on the front line. So we'll have quite a few guest speakers today. I'd like to just briefly touch on testing, because testing for COVID has certainly been a hot topic. If you've seen the medical community's post, there's quite a demand for testing right now. So I'd like to just quickly clarify a little bit about testing. One is that we are not recommending that people use test-based strategies to return to work. We're recommending people use the symptom-based strategy for return to work guidance. So that means that if you have a positive COVID test and you have symptoms of COVID, which reminder, fever, chills, cough, shortness of breath, fatigue, loss of smell, nausea, vomiting, diarrhea, sore throat are all common ones. If you have symptoms and you test positive for COVID, then you should be at least 10 days since the onset of your symptoms and at least 3 days with reduction of symptoms and having no fever for those 3 days. And that's in the absence of having to take fever-reducing medicine. So 3 days and 10 days since the onset. If you test positive for COVID and you have no symptoms at all, then you need to wait at least 10 days since that positive test. That is what we are recommending for return to work guidance, not 2 negative tests, because simply there are just not enough tests to do that for every single positive that there is. People are also asking a lot of questions about what type of testing is needed. And really, when I'm talking about COVID testing, I'm talking about PCR testing, which is the nose swab, or sometimes it's done in a throat swab, but it is a swab. It is not an antibody test, which is going to be a blood draw or a finger prick. The antibody test is really to tell us if you could have had old exposure to COVID, and that could have been 2 weeks ago or it could have been 2 months ago. And it's not going to tell us if you are currently infectious. The other thing about testing is that if you are a close contact, defined as within 6 feet of someone who's a known and confirmed positive, and you're in that 6 feet space for at least 15 minutes, you're a close contact. If you're a close contact, you need to isolate yourself for 14 days, and you cannot test your way out of isolation. A lot of times we do recommend, if testing is available, to test asymptomatic close contacts, but the purpose for that is not for return to work like we were talking about. The purpose for that is so that we can rapidly identify those cases and then isolate their close contacts. And that negative test, say you test on day 7 after an exposure, and you're negative, that doesn't mean that tomorrow on day 8 that you couldn't then be positive. And so you really need to isolate for your full 14 days and not try to use a test to get out of that isolation period. So those are the main points that I wanted to make today, and I'll go ahead and introduce our first guest speaker. It's going to be Dr. Danette Null. She is the program director for the LSU Family Medicine Residency program here in Lake Charles. And Dr. Null is going to tell us a little bit about what she does, and then also a little bit about her experience with COVID on the front lines. Thank you.
Good afternoon. As Dr. Kavanaugh said, I'm Dr. Danette Null, originally from DeRidder, Louisiana. Actually was born at Lake Charles Memorial Hospital, and I'm now the residency program director at the Memorial LSU Family Medicine Residency Program. The reason I was asked to be here today was just to give some stories of how COVID-19 has impacted me. When I was thinking about that, I just again want to explain kind of my job. So as program director, it's my job to provide on-the-job training for recently graduated medical students who are going to be with us for 3 years to become family medicine physicians. So we work with them in the clinic, we work with them in the hospital, and make sure they're educated in several different departments within the Memorial system. So we're all about teaching them so that they will care for the patients in our community in a safe, effective manner, and also care for anyone from newborn age all the way up through elderly and in between. When we were first told about COVID-19, I really thought, oh, this is going to be something similar to the flu. But as I learned more about it and did more reading, I realized that this was significantly different and we needed to act quickly to keep ourselves safe. So very early on, we implemented changes within the residency program so that we required all of our faculty, residents, and staff employees to mask. Since we have done that, we've not had a single person within the residency infected with COVID-19 by seeing patients there at the residency. Unfortunately, we have had some of our young, healthy resident doctors become infected with COVID-19 through interactions with people in the community who have been positive. And that has been very difficult to watch, to see a young, vibrant, healthy physician be put out of work for a period of time, have their education delayed. Some of those were infected very similar to flu. They would have fever, chills, be too weak to get out of bed, while others would have super high heart rates with little exertion at all and feel short of breath most of the time. Even after numerous weeks of convalescence, some of those doctors don't quite have the stamina and endurance that they had months ago. So we're still watching them slowly but surely improve. So again, that community spread is definitely something that we're concerned about and has affected us as a residency. When you have something like that happen, we also at one time had 13 members of our staff quarantined all at once, which is very difficult. You have to rearrange schedules, you have to cover nighttime calls. It's definitely something that we do not want to have to experience again if we can help it. Just like one person in the residency gets affected and it affects all of us, our community is no different. When you have one person that becomes infected with COVID-19, we're all interactive with each other, and so just because one person gets infected, it can spread very quickly and affect numerous other people. Think about the different restaurants and businesses that have had infected employees and they've had to shut down. So it's things like that that we're concerned about. 2 days ago, on a medical meeting that we were having, one of the physicians in the New Orleans area was telling us about having taken care of a patient that was positive with COVID-19 with blood work, admitted to the hospital, improved, had testing that showed that he was negative, was discharged home, and then several weeks later had new symptoms, was readmitted to the hospital, and tested positive again for COVID-19. So we are seeing some cases and having some concerns about just because you've been infected once doesn't mean that you can't be infected again. Our actions affect each other, and that's what I want you to remember, if you remember anything out of me talking to you today. I love this community, and I pray for it daily. I've been doing that regularly for years. All of the people here love very deeply and are very generous. And I know that you would never want to hurt me or to hurt your neighbor. And so I'm asking that you think about your actions and how they affect other people. Wear your mask when you're out in public spaces. Wear it correctly. Wear it from the bridge of your nose all the way down under your chin so that it covers your nose and your mouth properly. If you can avoid crowded spaces, do that. That's what we're asking, so that, again, when I wear a mask, I'm not wearing a mask as a political statement. I am wearing a mask because I feel like it is something wise to do that helps me not only take care of my family, but love my neighbor. So won't you join me in doing that as well? By doing that, that also helps us protect the healthcare workers who are trying to take care of you and your loved ones who are in the hospital. As you know, the number of cases and the number of patients that are hospitalized right now are on the rise, and we need a healthy workforce to be able to take care of them properly. Again, where the big concern is the community spread of COVID-19 and that infecting workers that are trying to take care of you and your loved ones. So please join us in keeping our community safer. Thank you.
Hi, we thank Dr. Null. Our next guest speaker is going to be Dr. Cliff Corville, who is a pulmonary critical care doctor at Lake Charles Memorial Hospital.
Thank you. My name is Clifford Corville, and I'm one of the pulmonary and critical care doctors at Lake Charles Memorial Hospital. And I wanted to just give some insight into what things look like on my day-to-day. I round up on the ICU and on the floors at the hospital, and I'm seeing several patients in our COVID ICU. And there are a lot of findings that we find to be concerning. These particularly relate to how sick these patients are, and also the numbers of these patients that we are seeing come in every day. As it stands this morning, we had 19 patients in our COVID ICU. We had 10 of those patients on ventilators. Keep in mind, our COVID ICU only has 16 beds, which means that we are having patients having to share rooms already. When you think about where we were on July 1st, when we had 9 patients in our ICU, in just 9 days, that number has more than doubled. And so you can anticipate what things may look like in 9 more days when we don't have any patients that we can fit in our COVID ICU. We will have to then consider closing down another ICU to fit more COVID patients, which will then involve perhaps eliminating any other elective or emergent surgeries that are being done. And really, we will be looking at having a major limitation in our resources that are available. As we anticipate that we have 19 patients in our ICU right now, 10 of those on ventilators. We pulmonologists and our nursing staff and our nursing directors are keeping a running count of what we have available. We have 10 of those patients on ventilators. We do have 30 more ventilators available if needed, but we only have 31 monitors to watch those patients. So we are in the current process of ordering 6 more monitors, which will buy us some time. But I don't know how much that's going to help us if we continue to have a doubling of our number of ICU patients every 9 days. I want you to keep in mind what it looks like to walk into a room and you see two people sharing a room. One person on a ventilator, the other person may not be. That person who is not on the ventilator is watching what is happening next to them, anticipating that that is going to be them. If somebody's heart stops, we have to do CPR. We will do CPR and do what we can to resuscitate that individual. That may occur in the presence of an individual who is literally sitting right there watching their neighbor decline. We have gotten better at being able to support these patients. Our therapies are slightly better than what they were in March when this was all new to us. This has allowed us to keep people alive longer. That, coupled with the fact that many of these patients are younger than what they were back in March and April. We have 18-year-old who is in the ICU right now. We have several 40-year-olds. We have people who are 50s and 60s and 70s who all were working, all had maybe one or two medical problems, high blood pressure and diabetes, but otherwise very functional members of society who are now critically ill and may not survive the next 2 weeks. It is not going to be pleasant for anyone if we have critical portions of our health care become limited to where we have nowhere else to turn. It is very frustrating for us. We feel this sort of sense of impending doom as there is no end in sight to what we see coming through our door every day, and knowing that we are going to have to reach a point where we have to limit what we can provide, which goes against the very nature of what we do, which is try to help everyone. And so we ask that you please help us and continue to wear masks and social distance. We know it's hard to have mandates, but if that's what has to be done to save people, then I guess that's what we'll have to do. Thank you.
Thank you, Dr. Corvell. Our next guest speaker today is going to be Dr. Manley Jordan, who is the Chief Medical Officer of Lake Charles Memorial Hospital.
Thank you, Dr. Kavanaugh, and good afternoon, everybody. And on behalf of the medical community, particularly Memorial, I want to thank Nick Hunter. Over the last couple of weeks, he's made himself very available and accessible, and so I want to thank Nick, as well as Dr. Kavanaugh. We've been on the phone multiple times over the last few weeks at all hours, but I want to thank them for their accessibility. What really needs to be conveyed is a story of two time periods for Southwest Louisiana. A time period before Memorial Day and a time period afterwards. It's a success story followed by a current trajectory that's not successful. So let's go back to March when we first started seeing COVID in the community. We first started doing our PCR testing probably the first week in March, and we started seeing cases in the community. The very next week, we started having hospitalizations. Our first hospitalizations at Memorial were March 15th. And there was a slow, steady increase, a slow wave, if you will, up until us peaking the first week in April. First week in April, we had a total of 32 COVID patients and 10 ventilators. And because the citizens of Calcasieu and the remaining 5 parishes in our region, they were adherent to the mitigating measures that we asked them to. The social distancing, the hand hygiene, the cough etiquette, and sanitizing the common touch surfaces. And because of that, we had a steady decline to where the last week in May 25th through 29th, we had 0 patients in the hospital at Memorial. 0. And then that's where the story takes a turn, Memorial Day. Not sure what happened. I think all of us know there's probably a human element of complacency. There certainly was a shift in demographics with regards to test positivity. We saw a younger demographic testing positive. And we've seen hospitalization rates escalate dramatically to the point that we're getting very close to meeting a threshold where it's challenging to maintain a standard of care that we are dedicated to. So let's go back again. The test positivity in the community as it started was 18%. It dropped to 2.5% right around Memorial Day. And it has slowly escalated from week to week, from 16 to 20, and now we're approaching almost a 24 to 25% positivity rate in our community, almost 1 in 4. The other alarming part of this is that 35 to 40% of patients with COVID are totally asymptomatic, and they're a younger demographic. That's very important. So, like Dr. Corvell said, a week ago, we had about 20 patients and 3 ventilators. now, this morning, we've got 41 patients in our system and 10 ventilators. Yesterday alone, we had 10 COVID admissions to Memorial, and we had 3 deaths, regrettably. Please keep in mind, we're still taking care of patients in our community with heart attacks, strokes, people needing surgeries, and people having car accidents. We're still having to do that and want to do that. The demographics has changed a little bit before and after Memorial Day, and it's not just locally. We're seeing this throughout the state and really in the nation. On a call with the governor yesterday, we noticed that the age demographics has shifted, as we alluded to. Younger population being admitted, we averaged at an age of 67, it's down to 61. Prior to Memorial Day, we had a predominance of female, about a 55 to 60% admission rate of females over males, and that's flip-flop now. We have more males. Prior to Memorial Day, we had 55% admitted were African American, and that too is flip-flop. Today, 55% are white. The good news, and there's a silver lining here, is that the acuity seems to be a little less. The mortality rate early on, 22%, has dropped down to 4%. And our ventilator utilization, even though it's growing again, it's less than what it was before Memorial Day. Comorbids are pretty much the same. We're still seeing people with hypertension, obesity, and diabetes. So let's talk a little bit about masking. Early on, our narrative didn't really include masking. The CDC and their non-pharmaceutical interventions didn't mention masking. And they mentioned the things we've always talked about. And there was a reason for that. The masking science has been a little bit inconsistent with regards to respiratory viral infections. For example, and we're talking about masking in the community, not the hospitals. Masking in the community was shown not to be very effective during the 2009 pandemic, the H1N1 pandemic, largely because those people were symptomatic from the very beginning. However, masking was shown to be effective during the original SARS-CoV-1 outbreak that caused SARS. So there was some inconsistent science regarding masking. But as we've continued to learn, as science has evolved with this virus, and it's been a very fluid, rapidly progressive process, we now know that masking in the community certainly adds an element of protection. So coupled with social distancing, coupled with everything else that we continue to talk about and encourage, masking is a very important element to slowing the spread. So today, in light of that, I'm representing Memorial and our medical staff. I'm going to be asking both parish government and city government to develop and implement a masking strategy that will improve compliance. Some people may call this a mandate, call it what you will. This, from the perspective of the healthcare worker, of the doctor, the nurse at the bedside, this is not a political statement. This is not a control issue. This is a plea from the bedside to help those doctors and nurses at the bedside, because we know masking works. So I want to thank you for your time and attention this afternoon, and thank Dr. Cavanaugh for having me.
And our last guest speaker is Mr. Kevin Holland, who is the CEO of Ochsner St. Pat's Christus.
Thank you, Dr. Cavanaugh. I just want to echo what my peers from Memorial have said. During the past 2 to 3 weeks, we are seeing record levels of COVID in our St. Patrick Hospital as well. We currently, as far as our numbers go, we have 8 positives in our intensive care unit, and we have 13 on our floor, and we have 5 PUIs, persons under investigation, and most of these PUIs in recent weeks have been converting to positive. So I think it's safe to say that those numbers are likely all positive in our facility. Similar to Dr. Jordan's story, we just weren't seeing these numbers quite as high back in March, April, and May. We have seen a significant spike in June. And I'll echo Dr. Jordan's comments. We have become we've become a lot better at treating COVID. We know a lot more today than we did 2 and 3 months ago. A lot of that has been through trial and just, a lot of diligent work by very outstanding medical professionals that we have in this community, but I will say that there's still a lot that we don't know. There's still a lot of nuances to this virus that make it very challenging, make it very difficult to contain, and we're seeing evidence of that right now. And the thing I just want to reiterate is that this thing's not going away anytime in the near future. I do believe that eventually we're going to have a lot better techniques and perhaps some type of vaccine that will allow us to continue to thrive and prosper as a society. But right now, it's here to stay. It's going to be with us for the foreseeable future. And the things that we are advocating from our medical staff to our leadership is we can't ask the community strongly enough to please continue to be diligent, to use social distancing, to take it seriously, to refrain from going out as much as you would perhaps under normal circumstances. And we also are advocating a universal masking strategy for Lake Charles. Clearly, there is evidence to support that mask does mitigate the risk of transmission and also yourself picking it up, and we also are advocating that as well. The other thing that we're seeing is we are seeing more staff that is also being impacted by the amount of patients we are also seeing. So for the sake of all of our healthcare heroes that are day in and day out fighting this pandemic, showing up for work, putting their own lives at risk, we ask on their behalf that you also consider being as diligent as possible. We will get through this. We've got outstanding healthcare resources in our community. We're going to continue applying them very diligently. Like Dr. Jordan said, we are seeing it impact all ages, and hopefully we'll continue getting better and better at treating this virus and getting it contained. But for now, clearly, any measures, the additional measures that we can take to stop the spread and to slow it down is going to help all of us here in the community. So I thank y'all and appreciate all the support that we've been given, and we're going to continue fighting the fight. Thank you.
And that is all from the medical community, and I will take questions.
Okay. First of all, can you tell me how many ICU beds are available in the community? We were given an anecdote about somebody who supposedly went to a local hospital and was sent on to Leesville because there was no ICU bed available.
So I will say that the bed availability has definitely decreased in recent days. The percentage available on a daily basis is released at noon every day on the website, and it will show how many beds and ICU beds are available. So for that question, I would say go to ldh.la.gov, and it will give you the tally for today, because I don't think I had a chance to look this morning before I made it here.
And just to clarify, so are you saying that after you've had COVID, if you've gone 10 days and you go at least 3 days without symptoms, you do not need a test?
I'm saying that if you test positive for COVID and have symptoms, then you need to be 10 days since the onset of the symptoms plus 3 days fever-free with substantially improved symptoms before you can be cleared to return to work.
Okay, so if you go at least 3 days after having been positive for COVID.
10 days.
I mean, well, no, first the 10 days, but then 3 days in addition to that
3
without
days
symptoms.
without symptoms.
You do not need a test.
Yes, because by then you would meet the criteria for return to work. But that criteria, I mean, we want to be able to test folks so that we can then identify their close contacts. So we would definitely encourage people who are symptomatic to get tested. But if you're positive already, so you've already had a test, and you go 10 days since that positive test, and you're 3 days symptom-free, you do not need a second test to clear you, is what I'm saying.
Okay.
Does that make sense?
Yeah, it does. We have people who at the end of the road are waiting to get another test before they go back to work. So I think that there's a lot of confusion with regard to that. Also, we had a viewer who wanted to know if people who are getting a second test are being counted again.
Right, so we do have a process in place to deduplicate that data. So of course, we are looking by name and birth date to try to pull out any duplicate results, because we are aware that obviously people do sometimes get tested a second time for various reasons. So those are being deduplicated. Of course, I'll say the system is not perfect. If someone has a misspelling of their name or a misspelling or a mistypo of their birthday, is it possible that one person got counted twice? I mean, I think it is, but that is not the norm, and we do pull those duplicates out. Okay.
Okay, we'll come back in a few minutes from some of our elected officials on the issues brought up by the medical community. Want to shift gears just for a moment. As many of you know, we have, earlier this week, the school board here in Calcasieu announced plans for the upcoming school year, and we appreciate Carl Brookhouse, Superintendent of Schools, who is representing them today. I'm going to buy a little time while he comes up. Are you able to? He's on crutches, so I appreciate him being here, and it was just very timely. So, Carl, we thank you for coming.
It looks like I got my elective surgery in just at the right time last week here, having my hip replaced. The hospital was full then, and I know it's full now. So thanks for having me. So we did yesterday release our correspondence about the opening of school for next school year, 2021. It provides two options for our students and parents to choose from. It does have a face-to-face option with a lot of safety issues involved. And I'll just mention a few of those safety issues before I talk about the second option. So the key in our elementary grades to opening face-to-face is what we call static groups. So when a child comes to school, they're going to be with their class of students all day long. They won't blend with any other class of students the entire day. If they go to PE, they'll go to PE with only their class. When they go to art or lunch or recess, they will stay with their class all day long. And that's so that we can know who was together. We will have static seating charts at every level that we have where we seat students. And so we'll know where students sit at any given time. That will give us the ability to know basically who they've come in contact with. We also, for our middle and high school, have been able to develop a schedule for next year that reduce class sizes dramatically. We will try to have some of our largest classes around 21. And you ask why 21? We've measured our classrooms and feel like to the maximum extent possible we can social distance in those classes. We may have to take some furniture out. We're prepared to do that with storage containers. And we'll do those things we have to do to set desks and tables far enough apart in that classroom to social distance. Now, those students will still change classes, but as you've heard lots and lots of times, the key to that is 15 minutes, 6 feet for 15 minutes. So we got to keep kids moving during the day, changing classes and getting through our hallways. We will have arrows, we will have decals, we will have signs that remind them to wash their hands and sanitize and social distance, and they're everywhere. They're positive little signs and CDC guidelines, and we're just going to have hundreds of them everywhere to remind people of what's important. We've installed foam hand sanitizer dispensers in every classroom in Calcasieu Parish. That's in process now. They have cartridges in them, so the students, upon entry and exit and any other time, can sanitize their hands. They'll wash their hands coming and going before lunch as well. Cafeterias will be places where they can only be there with their static group at a given time. And anywhere else that they eat, they will be social distanced. Our duty teachers and administrators will make sure of it. So there's all these protocols in place to try to get some stability and some normalcy back into people's lives, which is school. We know when we closed on March 13th, it's been difficult. for parents to go to work, for businesses to be open. Things get difficult when schools are closed. So we have this face-to-face option. We also know that there are people who aren't comfortable going back in groups. And so we are offering a full virtual option. And that option is open to any student in Calcasieu Parish, and we will provide a device up to 2 per family right now, and we may be able to do better than that when the time comes. We have laptops for our 3rd through 12th graders and iPads for our K through 2nd graders that will be available for checkout. So we will have full-time virtual teachers assigned to these students. We're enrolling now. Each virtual teacher actually can teach more than you would think of in a normal face-to-face setting. So they'll be assigned a pretty good number of kids to teach virtually. High school will be one format, one program. K-8 will be another format and another program. All of our virtual teachers will work out of Lake Charles Boston Academy. They're being trained, have been trained in the spring and are being trained between now and the time school starts to do that job effectively for those who don't already have those skills pretty well worked out. So those are our plans for the upcoming school year. We'll do temperature checks every day for every student in every classroom. We have about 4,500 digital thermal thermometers that we've ordered. Most of them are on hand now. We've ordered 10,000 containers of Lysol wipes. They're a little hard to come by, but we hope to have them in. We've ordered thousands of bottles of hand sanitizer. We have different pockets trying to get all that in. We do have 10,000 brand new Dell laptops sitting in the warehouse that we used our CARES Act money to buy, alongside 2,000 brand new iPads that have never been used. So we can accommodate the virtual format. We're prepared to do that. Last point is the issue you guys have all talked about, and that's masks. So right now, our Louisiana Department of Education has a mandate in place that children in 3rd through 12th grade will wear masks all day long. We're extending that to say that during transition times, every student, no matter the age, will wear a mask, meaning our little ones, pre-K through 2nd grade, will wear a mask on the buses and when they're entering and exiting the school and during transition to recess, lunchrooms, and so forth. So anytime there's a possibility of running the other groups of students, they'll have the mask on. The 3rd through 12th graders, right now, like I said, the edict is that they will wear the mask all day. Of course, we have a lot of concern for our employees, and they're concerned. You know, if you're a teacher coming back to be with students all day, you're a little nervous right now, and I know they are. So many of them have reached out to us saying, hey, look, we know how important this is. We know that what we do is a vocation, not just a job, and we're going to do what we need to do. What can you do to help us? So we have purchased face shields, clear face shields, in addition to the masks for our teachers. Sometimes it's important for the student to see the teacher's face. They can't communicate without seeing the teacher's face. So we bought the face shields. We are going to install plexiglass at each teacher's workstation that will hang from the ceiling. We kind of got that idea from the police jury and some of their workspaces. Very easy to install, 3x4 sheet of plexiglass. The teacher then will have another layer to stand behind to give them that sense of security if they're only wearing the shield to be able to address the class. And so there are things like that. Of course, we're going to inform our teachers before they come back of all the leaves that are available to them. And I know we'll have some teachers that are at risk that will have great concern and need to do something other than being in the classroom. And we'll try to work with them. The problem is when we have 20 students sitting in a classroom, the work from home option just doesn't work for us. The kids can't be there by themselves, obviously. So that's our challenge with our 4,950 employees is to make them as comfortable as we can possibly make them to serve 33,000 students. And by the way, we have ordered 78,000 masks. which is 2 washable masks per student and per employee. And those will be provided to them when school starts. We are allowing students to wear their own masks. There are some protocols associated with that, obviously, in our dress code policy, depending on the level of student, and those will be made very public as well. So that's the plan. I'd be glad to answer anybody's question. Somebody approached me yesterday and said, man, this is just not detailed enough, right? So the plan is like 17 pages. The online virtual connected classroom is 10 or so pages. And my answer to that is every question brings 10 other questions. We can't answer them all in a static document. We're going to answer them as they come. We pledge to do that. If people have questions, they can always ask us, and we're going to answer them. But to put them all in the initial document that we roll out just wasn't feasible. What we tried to accomplish yesterday is to let parents know what their options were going to be, start preparing, start making decisions, and to go ahead and ask questions and share their concerns where those might exist.
Just wondered the extent to which you all consulted with medical professionals and if members of the local medical community agree with the plan to have some in-person school.
So we've talked to medical professionals. We've talked to the state health officials on numerous Zoom calls. And the answer we get from a medical standpoint is the guidelines are the guidelines, and they're not going to change, right? But the Department of Education's worked with those same medical professionals to come up with an understanding that, you know, there's 2 sides to education. There's mental health, and then there's the regular education process. And so we have to all decide at what point it's healthy for students to not be in school, too. Obviously, physically, it may be more healthy for them to be at home. Emotionally, socially, psychologically, at some point, they're going to need to be in a school environment. And when that point has been argued all the way around, right? And I don't think anybody has the answer for that, which is why we are offering the virtual option for those people who feel uncomfortable coming back face-to-face. But we have a lot of folks who have reached out and said they're ready to come back. And so we're going to try to protect them to the greatest degree we can while they're there. Thank you.
Thank you, Carl. Very informative and very timely as well. We want to have an announcement. I'll ask Dick Grimion to come forward. The United Way has a couple of food distribution events coming up soon. He's going to give a few details on that, and then we'll hear from a few of our local elected officials.
Thank you, Brian. On behalf of Denise Durrell with the United Way, they're hosting 2 of these food distribution events. Both will be open to the public, and both will be first come, first serve. They have enough food for 700 cars. The first event will be July 16th at the Lake Charles Civic Center from 11 a.m. to 1 p.m. The second event will be on July 30th at the Beauregard Parish Fairgrounds, again 11 a.m. to 1 p.m. And just remember, it's the first 700 cars that show up, so be there early. Thank you.
Okay, thank you, Dick. We'll now hear from Brian Abshire, Police Jury Vice President. President Tony Gilroy is unable to attend today. We appreciate Mr. Abshire being here.
Just a few words. The message from our medical community is consistent and it's clear. We all need to do a better job when it comes to simple things like social distancing, washing our hands, sanitizing, and wearing masks. I know it's inconvenient, but I encourage everyone to mask up. Less hospitalization will help protect the most vulnerable in our community, and that's the most important message right now. Hospitals need the ability to keep up with the increasing cases and hospitalizations. That way capacity can improve, hospitals are able to care for the sick. We're ready to get back to normal, all of us. but it's the little things that are going to get us closer to that reality. Our community is strong. We can move forward together. I encourage everyone to wear their masks. Most important takeaway. We will have an executive policy group meeting tomorrow. That way we can discuss other options, and you'll be hearing more out of the police jury and the mayors and other local officials to let you know what our further options are. So.
It sounds like the doctors are asking for an ordinance or a mandatory mask rule. What do you think about that?
Well, we're going to have discussions tomorrow and see what our options are and how we can go about putting that out to the community. So, thank you very much.
Okay, thank you, Brian. We'll next hear from Mayor Nick Hunter of Lake Charles.
Thank you, Brian. Good afternoon, everyone. I've got to give a lot of kudos to the school board and really every agency that's represented in this room and throughout Southwest Louisiana. I hope people understand at this point the gravity of the situation and the weighty decisions that have to be made. There are no perfect answers to what we're going through right now. None of us have ever been through this before. We oftentimes think about what is one of the most catastrophic or biggest events we've ever been through here in Southwest Louisiana, and we always seem to come back to a hurricane. We've been through hurricanes. Let me tell you right now in Calcasieu Parish, more people have died. More people have died because of COVID-19 than Hurricane Rita. And this has lasted longer. The effects of this have been longer than many other events that we have been through. So the situation is very real. This is not a hoax. It's not an old wives' tale. What we're going through right now in Southwest Louisiana is very real for our medical community. We have always, from the onset, wanted to avoid overrunning our hospitals. We know that COVID is going to be around for a long time. We know that locally, there's probably zero we could do to completely eliminate COVID-19 in our community. But there are things that we can do to help ensure that our hospital systems are not overrun. And if our hospital systems do get overrun, that affects more than just COVID-19 patients. That affects more than just the family members and friends of COVID-19 patients. In late May, we were in a stable spot here in Southwest Louisiana. That has changed today. Numbers do not lie, and the numbers of hospitalization rates and available ventilators at our local hospitals do not lie. These are not numbers from a talking head 3,000 miles away. These are the facts and the numbers of local people that I personally trust and consider friends in this community. I have personally had conversations with about a dozen doctors, different doctors, local doctors, over the last 24 hours. And the message has been very concise and very direct that our community can do more to help to prevent the spread of COVID-19. Those conversations with doctors, especially doctors affiliated with our local hospitals, have been absolutely sobering. They have been sobering as a mayor, and they've been sobering as a human being to hear some of the cautions of what could happen if the trajectory continues. I'm very happy that the Executive Policy Group is meeting tomorrow. Just as a reminder, that group consists of all the mayors in Calcasieu Parish and the Calcasieu Parish Police Jury and the Sheriff's Office. If certain steps are not taken, and if our numbers do not improve, again, our hospitals could be overrun. I want to let everyone know that as of tomorrow, to enter a city building or to ride on a city transit bus, visitors will be required to wear masks, as well as our employees, which they have been doing that, and that is for the safety of our employees and visitors. Ladies and gentlemen, there's lots of options out there. One of the worst options is if this trajectory does continue And it's not up to locals, but perhaps up to agencies above us, that we would be forced to push back to a phase 1 or forced to push back to a lockdown. That is a possibility. And I don't want to see that happen. I don't think anyone in this community wants to see that happen. So with that, I'll take any questions.
So what is your position on a mandatory requirement that people wear masks? And if you do favor that, how would you enforce it? What, if any, penalty would there be?
Sure. Great question, and it all depends on what type of proposal it is. I can tell you that right now, with the information I'm hearing from the medical community, it is absolutely something that we should consider. It depends on the proposal, and you asked about how would it be enforced. I don't have the answer to that yet, so it would be irresponsible for me to comment on a plan or a proposal before it's formally put together and before it's formally launched. In addition, I want to remind everyone that the city of Lake Charles is an autonomous city, just like other municipalities are throughout the Calcasieu Parish, and then there's a Calcasieu Parish police jury. So ideally, you would see a group come together with a consensus, but it is certainly my opinion that more must be done.
Just to clarify, are you saying the executive policy group is going to develop some type of proposal and ask the different entities to consider passing it?
I'm saying that the executive policy group tomorrow, and I'll let Brian comment a little bit more about the makeup of that group or what that group does. But tomorrow, I believe the conversations about all options will be on the table with the executive policy group. Thank you.
Thank you, Mayor. I try to lend a little more detail to that. Mayor Hunter said it well. The group, just as a reminder, that group actually goes many years back. It is voluntary in the sense that we recognized in hurricanes, even before Rita, but certainly since, when you get into things like recommending or making decisions on evacuations, sheltering, but in any type of event, and pandemic included, having the leaders of the local parish officials, which again, police jury president for the whole parish, including cities, police jurors represent cities, the mayors of each of the 6 municipalities and the sheriff are on that. Superintendent of schools actually attends those as well, because very often that affects, what happens at schools affects the rest of us. So meetings are to share what is going on in their particular areas and compare notes, if you will. Nothing out of there, they aren't a legal body. So to try to answer your question, this is simply the legal part. A police jury, president, police jury could pass something, if you will, an executive order during an emergency period, and or any of the mayors could on their own, or they could both. That's the legal part. I'm very proud to say over the years there has been consensus on most issues, and we have consensus that this is bad. When you get down to having to go to a level we haven't had before, it is a tougher thing because we're getting that point where it's got to be a little more restrictive. So we have to have that discussion, and Nick is right. I think coming out of that, we'll have a much better idea, but I just wanted to clarify the legal mechanisms for that. And one other thing, the executive order and as amended that the governor has done from the outset of this has been clear. Localities, cities or parishes, if they choose, can go further than his order, but not less. We couldn't choose to not do something he has put in law. We can go further. Some parishes have done so, different methods. So I just wanted to make sure everybody understood that. Hope that clarifies a little. We do want to hear from the Sheriff's Office. Stitch Gilroy, Chief Deputy of the Sheriff's Office, is here today to update us from the law enforcement perspective.
Thank you, Brian. I just want to reiterate some of the things that have already been said. You know, Sheriff Mancuso is very much in support of our medical community and as far as the recommendations about masking up and just to protect our public. It's important that, you've probably heard many times people say that, you wear a mask to protect other people. And for those people who choose to go out there and not wear a mask, it's really totally irresponsible to your fellow citizens. When you choose not to wear a mask and you end up with COVID and you have to present to the hospital, you affect the health of our healthcare workers. Not only those workers, but after those people take care of you, they go home to their families. So you could affect their kids, you could affect their spouses. We as first responders, we have to interact with people every single day in our job. We have to continue to go out there and enforce the law and do our job. And you put us and our families in jeopardy. Think about all the grocery store workers that are out there working hard every day trying to keep food on the shelves. If you don't have to expose those people to COVID-19, please just be smart and think about the families that you could affect. At the Calcasieu Sheriff's Office, we instituted a policy last week where masks are mandatory within our buildings. We had a number of employees that had contracted the COVID during the course of their job. Once we instituted the mandatory mask, we also instituted a trace contact team. We were able to bring our number of employees that were positive way down. We were able to reduce the number of employees that we had to put into quarantine. So, when you talk about the first responders, the healthcare workers, the school board workers, the parish workers, it affects a lot of people, and our biggest challenge is to protect our workforce, because without a proper workforce, we can't go out and do our jobs the right way. So my message to the community is wear the mask. Please, I'm begging you, asking you, wear the mask. If not for anybody else, just if you don't want to do it for yourself, do it for your friends and your coworkers. So my message today is, please mask up for all the Calcasieu. Thank you.
Stitch, what do you think about whether wearing masks should be mandatory, and do you have any vision for how something like that might be enforced?
Me personally, I think the mask should be mandatory, just for the exact reasons that I stated before, Teresa. The only problem is who could enforce that. I can tell you, we don't have enough police officers to enforce, to go out and write tickets to people who don't wear masks. Besides that, you would overwhelm the court system with the paperwork and a lot of responsibility for people not wearing a mask. Basically, people have just got to make a commitment to wear this mask for your coworkers, for your family, for other people. And it's not comfortable, but you also have to make sacrifices in these dire times. And I don't think that's asking too much of anybody to walk around with a mask. It is uncomfortable, but think about all the good that you're doing to help our community.
Okay, thank you very much, Stitch. That's the list of our speakers today. I want to try to summarize, and this is from talking with a lot of the medical folks, Dr. Kavanaugh and Jordan, everybody else. And I'm going to try to take a layman's shot at this to try to put the big picture in view. What is the goal? And in listening to the medical professionals, the goal is to get that caseload down with COVID so low, you're not going to eliminate it, but you get it manageable in order to allow all the medical facilities to provide not only health care for the COVID affected, but everybody else. And they tell us that we were doing very well. I think Dr. Jordan mentioned that. If you go back to the early period where you had the combination of a stay-at-home, recommendations to mask, wash your hands, social distance, all of that. This community did that very well. And all of those combined brought it down to where we were seeing on average, I don't know, maybe three new cases a day. And somewhere around Memorial Day weekend, it started changing, and there's different reasons for that. But basically, we have found ourselves back where we were, but maybe even worse. And it's because we have let off the pedal, if you will, on the things that worked. So the question before local officials and medical and just elected and others is, how do you get that back down to that goal of lower case management that is manageable and you can use contact tracing and so forth? All of us agree, I think nobody wants to see going back to shutdown, if you will. So is there a way to do something short of that that would have an effect that would be very significant? And I think the others have answered the issue. It's not everything, but whether or not masks are utilized much more is felt by a lot of people to be a very key answer in that. So that's the decision point. And because it's not, there's a lot of effects other than medical, having everybody mandated to do anything, you've got to understand what we're dealing with. So that, I think that's where we are, and that's the strategy, is to use some of those same ways but not go back to shutting down. So I'll try to stop there. I'm going to get in trouble because I'm not a medical professional. Any other questions, though, on what any speakers we've had? Great update on information. We continue to meet and discuss.
Just wanted to ask, that meeting that you're talking about tomorrow, what time is it? Where is it? And is it open to the public?
Right now, I believe it's scheduled for 9 o'clock. It's not a public meeting. These are very informal, just getting together in a room, probably up here. It'll be before noon, but it's not a public meeting. Certainly, if there's any announcement to come out of that, we will let the public know. I don't know if there will be, but if so, we certainly would communicate that. Okay, we thank everybody for coming. We will continue to keep everyone updated as the issue develops. Thank you.